The Voice Vista Podcast, venture by Pooja Prasoon. The Voice Vista presents Candid Podcast Show Special Talks. या एपिसोडमध्ये प्रथितयश पॅथॉलॉजिस्ट आणि इंडियन मेडिकल असोसिएशनचे अध्यक्ष डॉक्टर सुधीरजी संकलेचा यांचं स्वागत आहे. डॉक्टर संकलेचा हे मेडिकल डायग्नोसिसमध्ये अत्यंत निष्णात आहेत. आज आपण त्यांच्याकडून जाणून घेऊया त्यांचा या क्षेत्रातील प्रवास आणि आरोग्य सेवेमध्ये पॅथॉलॉजीची विकसित भूमिका. पॅथॉलॉजी आपल्या हेल्थ जर्नीमध्ये फ्रंटलाईन डिफेंडर म्हणून कसं काम करते हे जाणून घेण्यासाठी सुरू करूया कॅन्डिड पॉडकास्ट शो स्पेशल टॉक्स.
Hello everyone, I'm Dr. Sudhir Sankalecha and welcome to this edition of Voice Vista by Pooja Prasoon. I'm a practicing pathologist since last 29 years, practicing in Nasik. So today I'm here to talk about a very important topic which we see nowadays, mushrooming. What is that? Health checkups. It so happens that one of the person who is known to us suddenly passes away at a very young age, and we start screaming, oh, we become restless and we say, oh, let's do our health checkup. We start discussing amongst ourselves what to do, and everyone tells us one thing: go and get your health checkup done. And without really knowing what is the health checkup, we just go, then we search, then we have n number of advertisements, n number of things to our exposure, like we have this social media pop-ups coming up, Facebook, that go and get your health checkup done. Friends, what is this concept of health checkup at all? For that, first we have to understand what is health. If we know what is health, then only we will be able to tell what is health checkup. So health is what we are. Healthy without any disease. So normally, when we are able to do everything without any symptoms, fully energetic, it is considered that we are healthy. That is our health. And when we say health checkup, that means we just want to know the status of our health. Because what we see is the external appearance, and what we are interested in knowing is what is going on inside our body, what is happening inside our body. And so this health checkup concept has come up. But is it that important that we should be doing it? When certain questions should come to our mind when we say health checkup. Who should do it? When we should do it? Is it absolutely essential to do the health checkup, or is it optional? What to do it? Where to do it? All these questions, we should be knowing the answers of these questions. Nowadays, there is a fad of this health checkup. All these corporate hospitals, corporate laboratories, they are coming up with this concept of health checkups. You open up any social media, you open up any Facebook, you get pop-ups that 300 rupees and 60 tests, 400 rupees 80 tests, this kind of things, and you get attracted to this very attractive offers of health checkup, and many a times we succumb to these offers. But we need to understand the concept of health checkup. In the first phase, what is the purpose of doing health checkup? Why do we want to health checkup? Health checkup is good. There is no harm in doing health checkup. But is it essential? Say a person who is just married, maybe just 30 years of age, doing very well, going to office, working fully, going to gym, doing all his activities. Does he really need health checkup? No. The answer is no. He does not need any preventive health checkup. Because how long you will be doing these health checkups? Are you going to do it every 6 months, every year? There is no end to it. So when we hear some mishaps, we get attracted to this health checkup business. And the industry captures your mentality, your fear, and they grab that and then they promote their health checkup packages. Friends, it's very important to understand the concept of health checkup. Now I am going to tell you the real idea of health checkup. So what is this health checkup? Health checkup is basically we can do the checkup of certain things of our body. What are they? It is pathology laboratory tests, it is imaging, that is radiological test, then it is cardiological workup. Mainly people are concerned about the sudden deaths which occurs. We are worried about whether anything going on in my heart, because we listen that so and so died of heart attack. And when we hear that he was young, we are worried. But then there are multiple factors which causes that, which we don't take into consideration. So we have to understand first that what are the types of health checkups we do. So we do blood tests, we do radiological tests, and then we do cardiological work. What all we can check? There are n number of elements in our blood. So when you see these advertisements which says that do 60 tests, 80 tests, don't succumb to these ads. They are of no use. You need to understand that our body, all the elements, biochemical elements in our blood are in dynamic state. What do you mean by dynamic state? Dynamic state means it's a changing state. So the moment I check my blood for certain elements, after 1 hour if I check, the values will be different. So it is in the dynamic state. So sugar is changing, electrolytes are changing, all our parameters in the blood are always constantly in the changing state. In the morning, the reports are different. In the afternoon, we call it diurnal variation, morning, evening variations, stress related variations, exercise related variations, diet related variations. So it is very complex. So is it going to help? Say if I check these 60 tests today, and if I see the results, if I do it again, say after 3 days, are they going to be same? They are not. So there is no point in doing these multiple elements or multiple analytes in the blood in the health checkups. That you need to understand. So the elements or analytes which are of no use, which are in a changing state, and when you are healthy, it doesn't make any sense to test for these elements. So what all we can do? So let's go step by step. First of all, who should do the health checkup? Is 20-year male expected to do the health checkup? 30-year male is expected to? What time you should do the health checkup? So the very basic thing I'll tell you that till the age of 40, we are quite in a healthy state. So if you have any symptom, then you should do the health checkup. Then you should go for the blood tests. Till that time, you need not test for these health checkups. Who can do the health checkup before the age of 40? Yes, if you have a family history of certain things. If there is a history of heart attack in the early age in your family, if there is a history of diabetes in your family, then yes, maybe after the age of 30 or 35, you can do certain specific taste for these things. Otherwise, I would say 40 is the age where you can do a basic health checkup. What do you mean by basic health checkup? Basic health checkup is the health checkup where you do the basic parameters, where you see the basic parameters in our body. What are they? Let's go step by step. I'll talk about first the pathology test because they are very commonly done. And again they are done. So in pathology test, normally if you want to do your health checkup, just go for the simple tests like CBC, complete blood count, where you come to know about your hemoglobin. That is important, especially in women. It is many a times they suffer from anemia which goes unnoticed. You are acclimatized and it goes unnoticed. So do the CBC. What else? You do the sugar. You can do the sugar, blood sugar levels. It's a very simple test but very useful test. If you have any history of diabetes, you should be doing the blood sugar regularly because you never know at what time you are going to catch it. Then what else you can do? People say that you test for heart attack. What are the tests for heart attack? Let me tell you, there are very specific tests for actually detecting the heart attack, but you need to have symptoms for that. The probability or the risk factors for the heart attack is different, and tests for heart attack are different. You need to understand the difference between that. So the risk factor for the heart attack is if you have high fat levels in your blood. So we do the lipid profile test, which measures your cholesterol, triglycerides, HDL cholesterol, LDL cholesterol, VLDL cholesterol, and some ratios. So they are the risk factors. If you have cholesterol which is on the higher side, say more than 200, more than 250, triglyceride more than 180, then you can take certain measures to reduce them. You can work on your diet, or if they are very high, in that case you can even start with some medicines to reduce them. Does that mean that the cholesterol causes the heart attack? It is a risk factor for heart attack. It never causes the heart attack. What is heart attack? That in our vessels, certain elements from the blood gets deposited. There is an injury to the vessel wall where these fats are deposited, and it forms a plaque, it forms a blockage. That is the heart attack. But the very fact that for the deposits to get deposited in those blood vessels, you need to have some injury to those blood vessels. So there is a tendency to have that injury, and then it gets deposited. So many a times you would find a person with high cholesterol may not have blockages, even if his cholesterol is high. And vice versa, some people, even with the lower cholesterol, they can have these blockages. So cholesterol is just a risk factor. If you have the tendency for endothelial cell injury in that blood vessel, then even the lower cholesterol levels also gets deposited there, and you can get that. So lipid profile, doing lipid profile is just a risk factor. So never ever feel that my lipids are very good, so I will never get a heart attack. It is not so. Very, very important. People have this myth. They test for these health checkups and they have the normal reports, and then they are free that I am not going to get a heart attack because all my reports are free. You must have heard certain scenarios where someone says that fellow had a heart attack just a month ago, he had all his checkup done and it was all normal. still he got a heart attack. Yes, you can get a heart attack because they are all risk factors. It doesn't, the reversible is not true. So that is very important. So we check for these lipid profiles. Now, what are the other important organs in our body? They are heart, kidney, liver. These are three very, very important organs. And of course, brain. But we can check for this heart function by doing these risk factor tests like lipid profile test. For the liver, you can do liver function tests. Now there is a fun. These health checkup packages have a list of investigations wherein they check for all the liver function tests. But if you are healthy and if you are doing a preventive health checkup where you are not suffering from anything, you are absolutely healthy without any symptom, you need not do all the liver function test parameters. Even a single liver function test parameter like SGPT level is sufficient to understand your liver status. So that will reduce the cost of your testings. So you just do the SGPT test. If it is abnormal, then you do the complete liver function test. Similarly, it is about the kidney function. That you just do the serum creatinine level and that will take care of the kidney. And that will tell you about the kidney that okay, your creatinine level is normal, so probably your kidney is functioning well. So but just by doing these 4 to 5 tests, it suffices as a health checkup. But you end up doing 60 tests, 70 tests. People do tests like electrolytes, like sodium, potassium, chloride. Friends, when we are healthy, the electrolyte levels are always normal. They are never abnormal. So it is a waste doing testing for these parameters, especially as a part of health checkups. People do like lithium, whatever, phosphorus, calcium, what not they do. No need. So understand the importance that do a very specific testing which can give you some guidance, some guidelines regarding your health. Wherein you can take some measures. If your sugar is high, if your sugar is on the higher side, you can add a test like HbA1c levels, which is called as glycosylated hemoglobin. You get that done. But in the first place, you need not. Even tests like thyroid. Very commonly we do the thyroid tests. But friends, to have a hypothyroidism or hyperthyroidism, you will always get some symptoms. It doesn't happen that you don't have any symptom and then you are hypothyroid. It doesn't happen. So you have some symptoms. So again I am telling you that you have any symptoms, you have tiredness, you are feeling sleepy, you don't have energy levels, good kind of energy levels. Then these are the symptoms which you can address. And then you can add tests like thyroid function test or a TSH type of test. Otherwise that is also not needed as a part of the routine health check. So these are very few basic 5 to 6 blood tests which will take care of your basic health status. What else other than the blood test? Other than the blood test, we can do radiological test. Like we can do some sonography of the abdomen. Ultrasound we call it. You get your ultrasound done, you come to know the basic status of the organs in your abdomen, like size of the liver is good, your gallbladder is, there are no gallbladder stones, because certain things can go unnoticed without symptoms. You can detect them accidentally by doing this ultrasonography, like the gallbladder stones, like there can be some kidney stones. So these things can be picked up on the sonography, which can be done as a part of the health checkup program. You can even do the basic chest x-ray, because when you have any disease of the lung in future, if you are going to get anything, to compare the basic status of your lungs, you should be doing the basic chest x-ray, which can be used as a comparator when you have any problem. That how were your lungs when you were absolutely normal. So to have one basic chest x-ray with you is fine. So these are two radiological tests which will take care of your radiological imaging testing in your health checkups. What else can you do? If you have any history of heart attack in the family, if you have any history of heart disease in the family, valvular heart disease or any other heart disease, then you can get your cardiac checkup done. What can you do in cardiac checkup? There are three basic things which you do in this cardiac checkup. What you do your basic ECG, because there are some variations in normal ECGs. So when your heart is healthy, get your ECG done once, which is again can be used as a comparator. When you have any problem or any changes in the ECG, they need to compare it with your normal ECG when you were normal. So get one ECG done. Get one 2D echo done. Echocardiography is basically a sonography of the heart, wherein you see all the chambers of the heart, the flow of the heart, your pumping capacity of the heart, and a lot of things can be evaluated by doing your 2D echocardiography. And the third and fourth most important thing which you can do is the stress test, cardiac stress test, CST. So get your stress test done, wherein you walk on the belt where your ECG is monitored while you are doing the exercise. So that is recorded, and on after say exercising for 9 minutes or 12 minutes, if everything is fine, how much increase is there in your pulse rate, in your blood pressure, and how your heart is functioning. So if you do this stress test, that fairly gives you the idea that your heart is working fine. Even after this much stress, you're not getting any symptoms, you're not getting any changes in your echocardiogram. So your heart is working fine. So you are not likely to get any kind of heart attack in the near future, at least. That your heart is working. So these are the basic tests which suffices your health checkup package. Friends, we have been seeing that the people are going for so many tests again and again that they end up and something comes abnormal and they are worried. They go to doctors and something comes up out of that. No need. And the last part of this health checkup I will be telling is most important. What is that? Where to do this health checkup? Most important. See, there are commercial organizations, commercial establishments, corporate hospitals, corporate laboratories which are promoting these health checkups. But friends, my advice would be go to the individual doctor. Like you are doing a blood test, go to the pathologist who is running a independent laboratory who will be monitoring your blood tests properly. Go to the radiologist who is working independently, get your ECG, get your USG done there, X-ray test done there, and go to the cardiologist separately and get your cardiology workup done. Don't try to do everything under one roof, because these are the places where n number of people are coming there for this test and they're just going unnoticed. When you go to the individual doctor for your individual test, you can go and discuss it with that doctor. What are your reports? He will tell you whether they are normal, whether you need to do any more tests or what. So that is, we call it a consultation, which is very important. So that is most important thing, that when to do the health checkup, what to do the health checkup, where to do the health checkup, and what not to do. I have told you all these things. What not to do is most important. Where to do is again very important. And friends, you do, if at all you wish to do your health checkup, get it done this way. Is it absolutely essential to do the health checkup? No, not at all. You can get yourself tested when you have any symptoms, when you have any issues. Go to your doctor, consult him, he will tell you what to do. But if at all you are worried, you are concerned, then get this done. Get your health checkup this way. I hope you have understood the concept of health checkup and you would follow it and tell all your friends also about this health checkup concept. Thank you very much. Bye bye.
थैंक यू फॉर ट्यूनिंग इनटू द वॉइस विस्टा पॉडकास्ट। आप और भी इंटरेस्टिंग शो सुन सकते हैं thevoicevista.in पर। ये शो कॉन्सेप्चुअलाइज किया है पूजा प्रसून ने, प्रोड्यूस किया है द वॉइस विस्टा ने। गेस्ट कोऑर्डिनेशन में हमारे साथ रही सुनीता जी चौहान। डिजाइन किया है टीम क्रिएटर्स डेन ने। साथ ही एडिटिंग और प्रोडक्शन के लिए धन्यवाद टीम लर्निंग बी को। प्रोमो वॉइस दिया है राहुल ढोले ने। लाइक, फॉलो और सब्सक्राइब करना ना भूले।